Gail, this is Jeff Botkin. Are you with us on the phone?
Here.
Great. Thanks so much.
505th Street. Unfortunately, none of you are. So apologies for the confusion.
All right. You have.
Want me to,
yes, please proceed. We've got about 10 minutes for comments that you may want to offer the committee and the group.
Sure. So good morning, everyone. And let me just caveat that these comments really reflect nobody's views but my own, for what they're worth. And I did not have a chance to participate yesterday, although I did see the very helpful summary. So my comments are sort of jumping off that summary that I saw yesterday. And so I want to sort of lay out three somewhat controversial propositions at the outset. And I guess the overall point of starting here is that when we address the question of whether we can or should, and if so, under what circumstances, return research results, the law really doesn't give us an answer. And I would caution against sort of twisting ourselves into knots because of assumptions about what current law does or does not require. So first, I would posit that CLIA does not prohibit the return of research results, at least not in all cases. FDA really does not have jurisdiction over research results being returned in most contexts in which I believe we're speaking. And the HIPAA access rule does not really have applicability when it comes to research results. So as I mentioned at the outset, I don't think that law really answers the question for us of whether we may return research results or must return research results. And I don't think ethical principles clearly, one way or the other, answer the question of whether we should or should not return research results. So my advice or my approach to this would be that we really need to look at the reasons why people want the results and the benefits that might accrue from doing so, and concomitantly the reasons that researchers might want to return them, and then look at the concerns, both legal and ethical, that arise from doing so, and try to chart a course that maximizes the potential benefit while mitigating the potential risks. And as I understand it, on the plus side, so why do people want their information? There's a feeling that, at least by some participants in research, that this is their information, and if they are giving something to the research process, they are entitled or deserve something in return. And I think that there are some researchers who are sympathetic to that argument. There is the belief that in some cases this is potentially relevant health information, or at least potentially relevant information for people for their lives, even if not their health directly. And there are researchers, again, who are sympathetic to that view and want to share this. At the same time, there are risks in going down this road. One that I feel pretty strongly about is that there is a risk of blurring the line between the research enterprise and the clinical enterprise, which I think there has been, decades of effort to put a fairly strong divider between those two for the protection of human subjects. And we should be careful before eroding those lines because of the potential consequences, which include the risk that researchers will be perceived to be practicing medicine, which in addition to being impermissible under law, also could create a therapeutic misconception on the part of subjects. The risk that subjects/patients will not perceive the difference and will have mismatched expectations or unrealistic expectations about the value of participating in research. And then, of course, people have raised the issue of concern about the quality of the data. At the same time, to the extent researchers and subjects both are moving in this direction, at least in some cases, of wanting return of results and wanting to give results, I don't see any legal or ethical barrier, clear lines to prohibit it. So I think where that leaves us is needing to craft policies that try to keep the lanes clear, try to keep the manage risks and expectations, and again, to mitigate the risks. And again, and from a legal perspective, I would say that some of those risks on the researcher's side include legal liability, both if you disclose or fail to disclose. Now, we know that in the clinical context, those are not theoretical concerns. Those are actual. There's case law about people saying you should have told me this and you didn't, and you violated the standard of care. Or you told me this and you gave me the wrong information and I made a bad decision based on it. I think we want to avoid that happening in the research context. The more researchers are perceived to be acting like clinicians, the more that is a risk. There's also, to the extent that the research context is not a HIPAA enterprise, and I don't think that at least conceptually it is, there needs to be other mechanisms for protecting informational privacy. And subjects should know the limitations of those protections. They should not have misunderstandings that they are in a clinical context where HIPAA does apply if they are not. But ultimately, and I guess this is my final point, I think that these issues can be dealt with through contract principles, well set out expectations and clear expectations, as well as guidelines for how to do this. Should people want to, and the situations in which it is or is not appropriate, or is not a good idea, and how to structure the relationship and the understanding, or the contract, as it were, between the two parties, so that both sides achieve what they set out to achieve in the relationship. And let me stop there.